We will study the histology of spleen. So the spleen is covered by the capsule. So the outer covering of the spleen is known as capsule. Then it has lymphatic follicles, that is white pulp, and there is red pulp which is formed by cords of Billroth. So the connective tissue framework is formed mainly by capsule. The capsule sends trabecules. So these are the trabecules. This is also trabeculae present in the parenchyma of the spleen. So the parenchyma of the spleen is mainly formed by white pulp. So these are the white pulp and there is red pulp. So here, this is the capsule. Splenic artery will give branches that will enter through the trabecules. They are known as trabecular arteries. Now, the trabecular arteries will enter into the parenchyma of the spleen, and these form central arteriole. So, you can see this red vessel is the central arteriole. Now the T lymphocytes will form a sheath of lymphoid tissue surrounding the central arteriole. If we take the longitudinal section, we can see cylindrical masses of the periarterial lymphatic sheath, and this is the cross section. So in cross section we can see the mass of lymphoid tissue which is surrounding the central artery. Now this area of white pulp is known as splenic nodule, or it is also known as Malpighian corpuscle. Once the spleen is exposed to antigen, then there is formation and proliferation of B lymphocytes and it forms the germinal center. So we can see the central part of this lymphatic follicle is pale staining. So the central part is germinal center. So the proliferating B cells will push the central arteriole to the periphery. So how the white pulp is formed? White pulp is formed by splenic nodule or Malpighian corpuscle. Malpighian corpuscle are the lymphatic nodule in which there is eccentrically placed central arteriole surrounded by periarteriolar lymphatic sheath, and the central part has got germinal center. So in the middle part there are B cells and dendritic antigen presenting cells are present at the periphery. Okay, so in the center we have B cells and in the periphery we have the dendritic antigen presenting cells. So this structure is the white pulp or the splenic nodule, or it is also known as Malpighian corpuscle. So the parenchyma of spleen is formed by white pulp and red pulp. Red pulp forms major part of the parenchyma and it has two components. So there are cords of Billroth formed by the lymphocyte and there are splenic sinusoids. So the splenic sinusoids, this figure is of splenic sinusoids. They have wider or larger lumen compared to the capillaries, and these splenic sinusoids, the orange color structure is the sinusoid, and these are lined by endothelial cells known as stave cells or banana cells, and in between the banana cells or stave cells we have intercellular slits because the basal lamella on which the stave cell are resting is discontinuous. So there are intercellular slits, and the cytoplasm of stave cell contains contractile filaments which will modulate the shape and size of these stave cells. So this is about the splenic sinusoids. Then the second important structure is cords of Billroth. So these are the cords of Billroth. So these are irregular anastomosing cords mainly formed by lymphocytes. Then we have the reticular fibers, reticular cells, and macrophages, plasma cells. Also large number of RBCs are present, and the cord of Billroth are separated from the splenic sinusoids. So overall, if we see the histology, see the connective tissue is formed by capsule, then the trabecules, these are also trabecules. Then the parenchyma is formed by white pulp, which is formed by splenic nodule or Malpighian corpuscle, and the red pulp, it is formed by splenic sinusoids and the splenic cords of Billroth. Marginal zone of red pulp is the area that surrounds the white pulp, and it mainly consists of reticular fiber. There is network of blood sinusoids, lymphocyte, also antigen presenting cells are there. And function of marginal zone is antigen presenting cells bring circulating antigens in contact with the lymphocytes in spleen, and they induce immune response. Now we will see the splenic circulation. So the splenic artery will divide and redivide. It will enter in the trabeculae to form trabecular artery. The trabecular artery enters into the white pulp as central arteriole. This central arteriole is surrounded by periarteriolar lymphatic sheath. Then the central arteriole will divide and redivide into straight arteries known as peninsular arterioles. So these are peninsular arterioles which will continue as ellipsoids. The ellipsoids are surrounded by macrophages. There are two theories of splenic circulation. There is open circulation and closed circulation. So we will see the two concepts of splenic circulation. So first is the open circulation. So in the open circulation, the ellipsoid or the sheath capillaries will open into the red pulp of the spleen, and the blood will then enter into the cords of Billroth of the red pulp of spleen, and then it will enter into the splenic sinusoids. Whereas in the closed circulation, the ellipsoid or end-sheath capillaries will directly open into the sinusoids. So what is the difference between these two circulation? In open circulation, the capillaries will open in red pulp, and then the blood will pass in the splenic sinusoids. Whereas in closed circulation, the blood will pass from capillaries directly into the sinusoids. So in human being, only open circulation is present. So we have seen up till now that the blood enters into the splenic sinusoids. So these are the splenic sinusoids. The same here, these are the splenic sinusoids. So they drain the blood into the trabecular veins. So these are the trabecular veins. And from the trabecular veins, the splenic vein is formed. Union of trabecular vein forms the splenic vein. Now, the splenic sinusoids are lined by the endothelial stave cells, which are also known as banana cells, and intercellular slits are there, and they have microfilaments. They have actin and myosin in the cytoplasm, and the intercellular gap present between these stave cells or endothelial cells play a major role in trapping the damaged RBCs. So the damaged RBCs will be trapped by it. And again, we have to remember that the splenic arteries and veins are interlobular, and they are covered by fibroelastic coat, whereas the splenic arterioles are intralobular and they are invested by the lymphatic sheath. The functions of spleen are: it activates lymphocytes and it induces immune response. Then it is the site of proliferation of T and B lymphocytes. It helps in destruction of microorganisms and damaged blood cells. In embryonic life, the spleen is hemopoietic in function and it stores small quantity of blood in it. Enlargement of spleen is known as splenomegaly. It is commonly caused by hematological conditions like thalassemia, sickle cell anemia, then infections like malaria, and malignancies like leukemia. And splenectomy is removal of spleen, and common indications for removal of the spleen are injury to spleen or malignancies or severe hemolytic anemias. Histology of tonsils. So, identification feature or peculiarity of tonsils is presence of tonsillar crypt. So, this is the tonsillar crypt which is formed by invagination of epithelium into the internal surface of tonsils. It forms tonsillar crypt, and this crypt is lined by stratified squamous non-keratinized epithelium. Then beneath the epithelium we have the aggregation of lymphatic follicles, and these lymphatic follicles are secondary nodules as they have in the central part the germinal center or pale staining area. So these are the secondary nodules present in the parenchyma of the tonsil. Lymphatic follicles are supported by meshwork of reticular fibers, and in this meshwork we have Langerhans cells and lymphocytes known as antigen presenting cells. In the tonsils we do not have afferents, so the cells directly come in contact with pathogen and destroy them. And laterally, the tonsil is covered by capsule in which some efferent lymphatic vessels and fibroblast are present. Functions of tonsil. So the lymphocytes and Langerhans cells are antigen presenting cells and they destroy pathogen. Then immunoglobulin G and A neutralize humoral antigen produced by pathogenic organism. Also the tonsils develop immune response. Now coming to clinical significance of tonsil. So tonsillitis is a condition in which inflammation of tonsil occurs. It can be viral or bacterial in origin, and it can be acute or chronic. If it is acute, it is treated with antibiotics, and in case of chronic or repeated infections or recurrent tonsillitis, we suggest surgical removal of tonsils known as tonsillectomy. Then salivary corpuscles may be formed in the palatine tonsil. Few lymphocytes and desquamated epithelial cells will mix with the saliva and they may form salivary corpuscles. Peyer's patches present in the lamina propria of terminal part of ileum are also an example of diffuse lymphatic tissue. They come under gut associated lymphatic tissue. So these Peyer's patches are aggregation of lymphatic follicles present in the lamina propria of terminal part of ileum, and these are elongated thickening of intestinal mucosa. There are about 100 Peyer's patches present in the ileum, and the Peyer's patches are present in lamina propria, but they may interrupt the muscularis layer and they may even invade the submucosa, and they are present in the antimesenteric border of the ileum. The M cells are the columnar cells that overlie the Peyer's patches, and these M cells show recesses that will accommodate the lymphocytes and macrophages, and these represent bacterial antigen to immune cells. And the function of Peyer's patches is to maintain normal bacterial flora and prevent infection in the intestine. So these are all Peyer's patches, example of diffuse lymphatic tissue or GALT present in the terminal part of ileum. Appendix is an example of diffuse lymphatic organ or diffuse lymphatic tissue. It also comes under mucosa associated lymphatic tissue, MALT. So in general, the gut system is formed histologically by four layers. There is mucosa, then there will be submucosa, then the third layer is muscularis externa, and the outermost layer is the serosal layer. As appendix is completely covered by peritoneum, this will be the serosal layer. Now we'll start with the mucosa. So it is lined by simple columnar epithelium with goblet cells. Then in the lamina propria of the mucosa, we have the intestinal glands, and the peculiarity is presence of lymphatic follicles. So we can see abundant lymphatic follicles in the lamina propria of the appendix. Then this area is the submucosa. So in the submucosa again we have the lymphatic follicles. Then comes the muscular layer. So this is the muscularis externa, and this one is the serosal layer. So here in the lamina propria and submucosa we have lymphatic follicles.